Hello and welcome. I'm Dr. Steve Levine, founder and chief medical officer of Actify. Over the next few minutes, I'll present some background information on ketamine and give you a detailed description of what it may feel like to have a ketamine treatment. Unlike many other medications that were discovered by accident, ketamine was developed very much on purpose as an anesthetic for surgery back in 1962. This is a very important medication because of its safety. Unlike typical anesthetics like propofol that lower your breathing rate, blood pressure, heart rate, all of your vital signs, ketamine is actually a stimulant, especially at the low dose we use here. It cut its teeth during the Vietnam War, where it was known as the buddy drug, because it was considered so safe that your relatively untrained buddy, under uncontrolled conditions, could administer it to you on the battlefield to treat trauma. The antidepressant potential of ketamine has been considered since the 1970s, but it wasn't until the 90s that formal studies were started. The first paper was published in 2000, and the results were very dramatic. After more studies confirmed the results, I started treating patients with IV infusions in 2011. We've given thousands and thousands of treatments at this point, both as IV ketamine and nasal S-ketamine, so we know a lot about this medication. I'm going to go through with you what it's like to have a ketamine treatment, so you know what to expect. When people are well prepared for what it feels like, it's typically a pleasant experience. The number one thing that people say to me after a first treatment, fortunately, it's almost always with a smile on their face, is something like, "I know you said that was going to be weird, but that was really weird." The top 5 words that people use are weird, odd, strange, different, and intense. However, if we think about the nature of this medicine and the way in which it's weird, it actually makes a lot of sense. Ketamine accomplishes anesthesia by dissociation, meaning it causes a sense of disconnection or separation of mind from body. Now, that falls along a spectrum. On the mild end, it feels light, bubbly, floaty. More typically, it's a bit more intense than that, and people feel more, frankly, disconnected. People describe the sense that their body is in the chair while their mind is floating above them. Their mind is floating above them, looking down on them, observing them. A feeling of traveling or motion, like their mind is traveling around the room, or even, my mind is way out there. It feels like I'm off in another dimension. However, even if you feel like you're in another dimension, there's a tether back to reality. You maintain the awareness the entire time that you're in a medical office, having a medical procedure, and that what you're feeling is the result of a medicine. And you maintain the awareness that the medicine is going to wear off within a matter of minutes, and then you go back to feeling normal. These experiences are typically not hallucinations. Hallucinations are false, fixed perceptions. For example, hearing a voice that's not in the room, or seeing a vision of something that's not in the room. It would be like someone walking in this room right now and asking you, "What are you watching? There's nothing there." That would probably be very frightening, because you plainly see me and hear me, and no one would be able to talk you out of that. What happens during ketamine is more accurately described as a dreamlike or illusory experience. It's an alteration of perception during which you maintain a connection to reality. I mentioned before that what you experience during this actually makes a lot of sense. What I mean is that everything follows from the feeling of disconnection. Our bodies are constantly gathering information from the environment. Whether we're directly focused on that or not, we only have so much attention to pay at any given moment, and our bodies take up a portion of that. The temperature of the room, our clothes against our skin, physical pain, the chair under us, etc. If you feel disconnected from your body, you don't have to pay attention to all of that, and you have more attention to pay to your other senses. So in general, there's an amplification of your other senses. The volume knob is turned up. You become more sensitive to stimuli in the environment. Everything feels like more. Because of that, we try to minimize stimuli around you. We have private rooms. We put white noise machines in the rooms to block out background sound. We try not to bang pots and pans around you. And we try to leave you alone as much as possible. We've learned this the hard way. When I first started treating people, I was pretty nervous because this was new. No one else was using this medicine clinically. So I was right in people's faces. I was asking them, "Are you okay? What are you feeling now? Are you all right?" It was really annoying. People don't want to be asked a lot of questions during this. They want to be left alone. It's a very internal, introspective experience, and outside interference tends to be unwelcome. People tend to be most comfortable in a darkened room with minimal noise, reclining, listening to music with their eyes closed. The nurse will check your vital signs, then depending upon which type of treatment you are having, start the IV line or help you self-administer the nasal spray. It will take a few minutes to start to feel the effects of the medicine, and then those feelings will last for 40 to 45 minutes. We'll check your vital signs a couple of more times during the visit, and if you're doing okay and feeling comfortable, we otherwise hang back and let you be. We're listening carefully for any sign that you need us, and if you do, we'll spend as much time with you as you need. But you'll most likely be fine, so we'll let you relax. You'll also be given a call bell that you can press if you need us. People often find music helpful. It grounds them, gives them something familiar to hold on to. You're also welcome to have someone in the room with you, but I recommend that during the time you feel the medicine, not to talk. It can be hard to find the words or keep track of where your thoughts were going, which can then feel frustrating or confusing. Now, if you're feeling uncomfortable at all and it's reassuring to talk, by all means. But barring that, I recommend just sitting back and going with it. Visually, it depends if your eyes are open or closed. If they're open, you can have some blurring or doubling of your vision. There can be a sense of motion or traveling. Once the medicine starts to clear, that sometimes causes a feeling of motion sickness. Therefore, if you're comfortable with it, I recommend keeping your eyes closed. If your eyes are closed, then it's a different visual experience. If you close your eyes even right now and actually look at what you're seeing, it's not just darkness or nothing, right? You see lights and shapes and colors. Most of us tend not to sit around all day looking at the show with our eyes closed, but during a ketamine treatment, you may watch the show, and it will likely be more colorful, brighter, it can have a texture to it, and you can feel like you're traveling around in it. You're not hallucinating, it's really there, it just takes on a different meaning. But this is why people sometimes describe it as psychedelic or trippy. There's a paradox with ketamine. In a couple of ways, it can feel like you're out of control. However, you are fully in control the whole time. You can feel out of control of your body because you feel separated from it. You can also have some physical numbness, usually fingers, toes, the area around your mouth, lips, teeth. That combination might lead an unprepared person to believe they can't move. However, you can easily move. In fact, even if you needed to get up and walk to the restroom in the middle of the treatment, you could do that. So it feels like you can't control your body, but you actually can. The other way people can feel out of control is there's a natural assumption that the weirdness you feel internally is apparent to an outside observer. This can make some people feel self-conscious. People have said to me, "I wouldn't want to see a videotape of this later. I'd be really embarrassed." Now, we don't videotape this, that would be weird, but I always tell people that if they saw a videotape later, they'd be bored because all they would see is themselves sitting in a chair. You may feel out of control, but you have full control over what you say, full control over what you do, and you'll have full memory of the events later on. Most people who go into this accepting the idea that they will feel a little weird for a little while, but that will clear, and then in the meantime, they'll be completely safe, and hopefully later they'll be feeling better. actually find this to be a pretty pleasant experience. Either calming and relaxing, euphoric, or very interesting and introspective. People often feel they're doing important psychological work during this, and that may actually be a part of how this medicine works. So that's ketamine in a nutshell. I hope you have a relaxing treatment and feel better soon.